What is a thyroid gland? What are the functions of thyroid hormones? Where is it situated? What are the complications? Okay, various types of thyroid disorders apart from hypothyroidism, hyperthyroidism. Okay, what dietary management is, evidence of dietary management we have so far. Okay, some of the medical management done, but we will not discuss in detail about the medical management aspects yet. Okay, but this is not on page number. This is not in any of your textbook. You just have to listen to the class. This is not from a textbook. This is from various research articles and sources available online. Okay. If at all you have to refer any textbook in future classes, whenever we take this particular Wednesday session on introduction for diseases, I'll let you know which page number you may have to refer from your dietetics textbook or nutrition science textbook. It will be mentioned. Okay. Apart from that, all the other disorders, when we are just discussing about the disorder, to give you an understanding of what these disorders are, what are the symptoms, what symptoms will be present in a subject or in your client. You are not supposed to give any medications. You are not supposed to do any clinical management on that. Whenever you ask, whenever you communicate with your patients or with your subjects, with your clients, on certain signs and symptoms, whenever you notice these kind of signs and symptoms, just ask them to refer an endocrinologist or consult their physician and get it checked, get the thyroid checked. Okay, you are not supposed to prescribe anything. You are just supposed to communicate this particular piece of fact. Okay, is it clear to all? What will be the what we will underline in this particular class? So we'll start today's session. Thyroid disorders. So thyroid disorder symptoms depend whether the thyroid gland is either underproductive or overproductive. Okay, is it hypothyroidism, hyperthyroidism? Just a snapshot. There are much more to it as well. Okay, either the thyroid gland is producing more than required or it is underproducing. Okay, some thyroid issues are autoimmune. That is, your own body attacks the thyroid tissue, it gets inflamed, and the thyroid gland can aggravate its function. Okay, your own body is causing an autoimmune disorder in which the healthy thyroid cells are getting attacked by the cytokines in your bloodstream. Okay, or maybe the eosinophils, basophils, they go and attack the thyroid tissue, healthy thyroid cells. That is the autoimmune aspect of it. Okay, treatment for thyroid disorders is often successful in majority of the cases, depending on what was the condition to start with. Okay, and it usually involves medication, surgery, and other therapies as well. Other therapies could be other lines of medicine apart from allopathy, homeo, ayurveda, whatever you prefer. That has also shown certain benefits alongside with allopathy. Okay, in allopathy, when does the surgery comes into play? If it is a tumor, okay, thyroid tumor, it has to be removed surgically. If it is a malignant tumor, again, it could you may have to use surgery. You may have to use combination of chemotherapy, radiation therapy, and surgery based. It completely depends on what kind of stage the patient would be. That is the part of the oncologist to decide. Okay, these kind of discussions, these kind of management comes from the oncologist side. Okay, so and these are the therapies available. These are the medication, surgery, and therapies available for thyroid disorders. So what does a thyroid gland do? Okay, thyroid gland is basically a butterfly-shaped gland. It is situated in the front of your neck, in front of the trachea. Trachea is your windpipe. Okay, in front of the lung, neck. It produces the hormone that plays a key role in regulating the blood pressure, body temperature, heart rate, your metabolism of not just your macronutrients, but also certain micros are used as catalyst as well. Carbohydrates, protein, and fat. Metabolism depends on the thyroid functions as well. The reaction of body to other hormones. Okay, like for example, calcitonin is one of the hormones that is secreted by thyroid gland. Okay, calcitonin acts just opposite to parathyroid hormones. We'll see. You can see here. This is the front view of the thyroid gland when you see it from front. Okay, the behind of the backside of the posterior part of the thyroid gland has 4 parathyroid glands on both the sides, left and right side. Okay, parathyroid hormones do the complete opposite function of calcitonin secreted by thyroid hormone. Okay, calcitonin is supposed to decrease the calcitonin is supposed to decrease the uh, calcium ions from your blood. Okay, it is not decreasing calcium from the bones. It is only decreasing the calcium concentration in your blood. How does it do? How does calcitonin achieve this? Calcitonin will prevent the osteoclast. Osteoclasts are cells within which is present inside your bone. Osteoclasts are supposed to dig down the bone and release calcium ions into the bloodstream. Okay, so it will inhibit, calcitonin will inhibit osteoclast to tell it to stop digging the bones. So there is no more calcium that is going into the bloodstream. That is how calcitonin functions. Okay, so the T3, T4 and calcitonin, these are the main hormones secreted by thyroid gland. Okay. Parathyroid hormones do the complete opposite function of calcitonin. Calcitonin will tell your bones to stop digging out more calcium, stop sending calcium into the bloodstream. Parathyroid hormone will ask the bones to dig more calcium and send more calcium into the bloodstream. So they have conflicting roles. A proper balance of these two hormones are required so that the blood calcium levels as well as the calcium mineral density inside your bones should be balanced. These two hormones should be should be functioning in a balanced way. So this is how thyroid hormones are secreted. Hypothalamus, the spelling they have mentioned in the pic is wrong. Okay, it is hypothalamus, HYPO. So hypothalamus is present in your brain. Hypothalamus is a gland. It will secrete TRH hormone, thyrotropin releasing hormone. So TRH hormone will go and activate your anterior pituitary gland. Pituitary gland has two parts: anterior, that is front; posterior, that is back. Okay, so this TRH hormone secreted by the hypothalamus will go and activate the anterior pituitary gland and give the signal to release thyroid stimulating hormone, TSH. Okay, so TSH is secreted by the anterior pituitary gland, and thyroid stimulating hormone through the blood circulation will reach the thyroid gland. And in the presence of thyroid stimulating hormone, these two hormones, T3 and T4, are released. Okay. T3 and T4 will increase your metabolism, protein, fat, carbohydrate. Metabolism will be increased for your growth and development. Increased catecholamine effect, catecholamines like dopamine, norepinephrine, epinephrine. These are the 3 catecholamines present in the body. What do they do? Dopamine, as you know, can anyone guess what does dopamine does in the body? Which part of your body has to respond to dopamine? Any guesses? Yeah, your brain has to respond to dopamine. You feel good, you feel happy. Okay, when the dopamine is released and the brain is not responding to it, you feel depressed, you feel sad. Okay, in cases of depression, serotonin levels, dopamine levels are either less or the brain is not responding to it. The brain receptors are not responding to the dopamine and serotonin secreted. Okay, dopamine, epinephrine and norepinephrine, these are secreted by your adrenal gland. Adrenal gland is present on top of the kidneys. Okay, so catecholamines are these 3 hormones: epinephrine, norepinephrine and dopamine. Okay, not just your brain, even your heart has to respond to dopamine for its contraction and relaxation. Okay, the way how heart responds to dopamine when you are excited. Okay, when you are happy and excited, your heart is also responding to the dopamine receptors, because of which it is like heart is also excited. It increases its the heartbeat increases. Okay, the contraction rate increases. That's how the heart responds to dopamine as well. Okay, so yeah, this is one of the reasons why in people who suffer from thyroid issues, you will see mood swings. Okay, fatigue, depression rates are quite high in people who suffer from thyroid issues. Negative feedback means when there is an adequate amount of T3 and T4 which is present in your circulating blood, okay, it automatically sends an inhibitory message back to the hypothalamus. No need to secrete more TRH hormones. Okay, so the presence of enough amount of T3 and T4, which is already present in your circulating blood, it will give information to the hypothalamus not to more TRH. Okay, but when people suffer from hyperthyroidism, okay, in that case, this negative feedback is also affected in a way that T3 and T4 is not able to give the negative feedback to the hypothalamus, because of which hypothalamus is secreting more TRH. Again, TRH will induce your anterior pituitary to secrete more TSH, and more amount of TSH will tell your thyroid gland to secrete more T3 and T4 hormones. Okay, so this is how thyroid hormones are secreted. The important factor here is the presence of and the healthy functioning and presence of TRH and TSH hormone, thyrotrophin releasing hormone and thyroid stimulation hormone. Thyrotrophin releasing hormone is secreted by hypothalamus, situated inside your brain, and also TSH, that is thyroid stimulating hormone, is secreted by the anterior pituitary gland, front part of the pituitary gland. Okay, is it clear to all? The basics of thyroid hormones, how it is secreted. Coming to the functions, general metabolism, increased metabolic rate and oxygen consumption by most of the tissues. When the tissues are able to consume more oxygen, it is able to produce more energy. Okay, more oxygen consumption means more energy is being produced. That's how your metabolic rate stays high. So it will stay high. Okay, more oxygen consumption of most tissues of the body. There are certain exceptions, okay, like testes, uterus, lymph nodes, anterior pituitary. The oxygen consumption of these specific parts of the body is not dependent on thyroid hormones. Okay, increased synthesis and activity of many intracellular enzymes, specifically sodium, potassium, ATPase, that utilizes energy, increased heat production. Okay, heat production is a byproduct of your metabolism. Whenever the body is in a metabolic state, the body naturally produces heat. Heat is a byproduct of various metabolism that takes place inside your body. Increased size and number and activity of mitochondria. The more mitochondria you have in your body, mitochondria is called the powerhouse of the cell. Why powerhouse of the cell? It is able to produce energy. Mitochondria is able to use ATP, okay, adenosine triphosphate. It is your mitochondria is able to use ATP, break down the ATP into ADP, adenosine diphosphate. Okay, adenosine triphosphate into adenosine diphosphate. Okay, so in that situation, energy is produced. So this breakdown of ATP into ADP takes place in the mitochondria. The more amount of mitochondria you have in your body, the more amount of mitochondria and cells with mitochondria you have within your body, the more energy your body can produce. When the body is able to produce more energy, your metabolism is high. Okay, so the rate of formation of ATP to energize the cellular function will also stay high. This is how you have a balanced weight. Your weight gain or your weight loss is balanced. Okay, ATP into ADP. Adenosine triphosphate is converted into adenosine diphosphate. Okay, and when this conversion takes place, energy is released. I have mentioned in the chat box. Lipid metabolism, breakdown of the fat. All aspects of fat metabolism is increased. Even the fat that is stored in the adipose tissue, adipose cells. Fat is stored in the form of adipose cells, adipose tissues in your body. Okay. When that will get used up, it will also get metabolized. Thyroid hormone will accelerate, okay, the oxidation of fatty acids by cell. Oxidation means burning the fat. Okay. In a common man's language, we say fat burning or burning the fat. Oxidation of fatty acids in the cell is the medical aspect of it, but to convert that into a simple man's language, it's a fat burning. It is a fat burning capacity of thyroid hormone. So thyroid hormones can accelerate your fat burning capacity. This is the reason why when you have too much of thyroid hormones in the body secreted in case of hyperthyroidism, you lose a lot of weight because the fat burning capacity is increased. Okay. Lower levels of cholesterol because you are burning the lipids. Okay. LDL, HDL doesn't matter. All different types of all aspects of fat, even if it is in the cholesterol form, even if it is in the form of LDL, HDL, adipose cells. Okay. All aspects of lipids are able to get metabolized in the presence of thyroid hormones. Okay. Triglycerides in the blood, phospholipids, cholesterol, these all will get metabolized because of thyroid hormones. Stimulate the formation of LDL receptor. LDL receptors, the more LDL receptors you have in your system, okay, there are less chances of you suffering from cholesterol. When LDL receptors are not present adequately in your system, okay, this LDL will get accumulated, okay, this low density lipid and fatty acids will get accumulated, and that will cause obstruction in your blood system. But when receptors are there, LDL will know exactly where to go and where to get used up with. Okay, so this is how lipid metabolism is affected by thyroid hormones. Protein metabolism. Small doses of thyroid hormone will increase the rate and formation of protein by ribosomes. Ribosomes is used for your RNA synthesis. Okay. RNA, ribosome nucleic acid. So that is RNA synthesis. The more RNA you have to make in your body, for that protein is required. Protein is required for the formation of ribosomes. Okay. It will increase the RNA synthesis by the genes as well, because the ribosome synthesizing proteins are present. Large doses of thyroid hormone will lead to excess catabolism of muscle protein. This is why weight loss will take place in hyperthyroidism case. Okay. Catabolism, as I have explained earlier as well, your body goes into the state of scavenging its own protein, carbohydrate, and lipid requirements from your own body, not from the diet, because you may be starving, you are not eating adequately, you are in the state of fever, infection. Okay, in that case, your body goes into a stage of catabolism, where the body, to meet its requirements to survive, it will go and attack the muscle protein, take away the adipose fat stores. Okay, glycogen stored in your body will be completely taken up by your body for its survival. Okay, so when there is too much of thyroid hormone, irrespective of survival, still the body will go into a state of protein catabolism. So muscle protein will break down. You will lose a lot of lean muscle in the same way, and weight loss will also take place. Extreme weight loss will take place. Gastrointestinal function, increased secretion of digestive juices, and the gastric motility, peristalsis of the intestine, not just intestine, the entire peristalsis of your GI system. It starts when you swallow the food. When you first swallow the food, that's when the first peristalsis start in your esophagus. It will end at your anus. Okay, that is how one peristalsis wave will end. Okay, so the motility will increase. So when there is too much of gastric juices or adequate amount of healthy amount of gastric juices being secreted in your body, and the gastric motility is also adequate, you have a natural appetite and zest for food. Okay. Increase for hepatic conversion of serotonin into vitamin A. As I mentioned, carotene, beta carotene. This is the format of vitamin A present in plants. Okay. Active form of vitamin A you will directly get from animal sources, but when you are having vitamin A rich food from plant sources, it comes to you in the form of beta carotene. Okay, to convert beta carotene into active form of vitamin A, thyroid hormones are required. Okay, so if in case of hypothyroidism, when there is no adequate thyroid hormone present, there could be a chance of keratonemia. Keratonemia means too much of beta carotene present in your circulating blood, okay, which is not getting converted into vitamin A so that the liver can store it. Liver can store vitamin A only in the form of active form of its vitamin A, not in the form of carotene or beta carotene or any other forms of plant vitamin A. Your liver, your body cannot store it. It has to be converted into active form of vitamin A with the presence of thyroid hormone, and then only the liver can store it. Otherwise, too much of beta carotene, carotenes will be present in your circulating blood. It will lead to a state of carotenemia. Okay. Reproduction essential for normal menstrual cycle and fertility. We will see that later how thyroid disorders will affect women in their different stages of their reproductive age. Increase the milk secretion in lactating women. So if the woman is suffering from hypothyroidism, there are chances that milk secretion may be suppressed. There are other factors also that will suppress the milk secretion, but thyroid issues is one of the common factor. Growth and development, essential for normal growth of soft tissues as well as skeletal structure, required for the production of and action of growth hormones. Okay, growth hormones and IGF for that also. So thyroid hormones, presence of thyroid hormones is required. Growth hormone factor, IGF. Second. Respiration, increased respiration due to increased rate. That is increased consumption of oxygen. Oxygen consumption will be increased in case of healthy secretion of thyroid hormone. Oxygen is getting used up by your cells. So your respiratory rate will also increase to compensate the oxygen that has been used up by your cells. Dissociation of oxygen from hemoglobin by increasing the amount of 2,3 dpg in RBC. That is how this is how RBC the hemoglobin is able to attach to oxygen ion. Okay, so in the presence of thyroid hormone, the oxygen ion can easily disassociate from the RBC and go into the other living cells where oxygen is required. Okay, in the absence of thyroid hormones, the RBCs will keep carrying on the oxygen ion. It will not be able to dissociate properly and be used up by the living cells. Cardiovascular function, increased number and affinity of beta 1, that is the medical part of it. You just have to understand, when thyroid hormones are present in adequate amount, your heart, your cardiac health, your cardiac cells are able to get and are able to respond to catecholamines. Okay, that for example, dopamine, epinephrine, and norepinephrine. Okay, the sensitivity of heart to these hormones is increased. Okay, epinephrine is also an emergency drug. Whenever there is a myocardial infarction, etc., epinephrine is used to revive the patient. Okay, because the heart muscles should be sensitive to it. Catecholamine is there are three types of catecholamine. It is hormones. Okay, catecholamines are hormones. Three types: dopamine, epinephrine, and norepinephrine. Okay, these are supposed to excite you. Your brain as well as your heart is supposed to be sensitive to these hormones. Okay, that's how you stay happy. You stay excited. You will stay enthusiastic about it. Okay, whenever you're excited about something, your heartbeats go up. Why? Your heart is getting because whenever you're excited, okay, your adrenal gland will release epinephrine, norepinephrine, dopamine, etc. into the bloodstream. Okay, and the presence of these hormones will excite your heart. Your heart will beat more blood. Okay, it will give you a sense of euphoria. It will give you a sense of happiness and pleasure from the psychological aspect. Okay, so this is the functions of catecholamines. Increased rate of blood flow in the skin for heat elimination. That is also how one of the way how the blood vessels respond to thyroid hormones. Increased cardiac output, your BP, systolic BP increases, diastolic will still remain normal. Systolic BP means what? Like, for example, if I ask you what is a range of a normal BP, what would your answer will be? You can answer in the chat box. Yeah, 120/80 is a standard, but it's a range. Okay, the blood, when we talk about blood pressure, there is always a range. 120/80 mm of Hg. Okay, that is something very standard, very normal. That we consider it, but normal BP should always be in a range. Okay, it could be from 100 to 120 or 130 in systolic. The diastolic should be around 60 to 90. Okay, that could be the diastolic range. So that is the healthy range. So 120/80 is normally what we tell about a normal BP. So 120, the top part, 120 is the systolic BP. This is the BP when the heart is contracting. Okay, when the heart is contracting, the pressure that heart exerts on the blood vessels. Okay, so that is 120. Diastolic is the 80 when the heart is relaxing. At that time also, the blood is exerting blood pressure. Even if the heart is in the contracted state, in the relaxed state, the blood volume will definitely put some pressure on the blood vessels. Okay, so in the contracted state, what is the blood pressure? That is systolic. In the relaxed state, what is the blood pressure? That is the diastolic. Okay, so systolic BP when the heart is in the contracted state. Okay, that will increase, which means more blood is pumped out. Okay, when the systolic BP is increased means the force with which the heart is contracting is higher. So more amount of blood is pumped out. That is the reason why cardiac output is increased. Okay, pulse rate, pulse pressure will also increase. Because in some people, when you check their pulse, okay, when you check their pulse, for some people it is very feeble pulse you will get. It's very difficult to find their pulse. Okay, they are living, breathing, they are walking, acting, they are doing their activities, but still when you touch their pulse, when pulse points, okay, it's very difficult to find that pulse. It is very slow, okay, very redundant pulse that you get. But in some people who are very active, who have a healthy amount of thyroid hormones being secreted, you will feel a very strong pulse in that. Okay, these are the functions that thyroid hormones have towards cardiovascular system. Nervous system, it promotes the growth and development of brain, specifically in the fetal life for the first few years. And specifically when the mother, if she is suffering from hypothyroidism, this growth and development of the brain cells of the fetus will also be affected. Okay, essential for normal myelination and development of the nervous system. Myelination is myelin sheath formation. If you take the structure of a neuron, okay, neuron is the structural and functional unit of the nervous system. Okay, if you take a neuron in the axon site, if you remember the structure and function of neuron, or after the class you can check as well. The axon area I have mentioned in the chat box. What you have to check. Axon. Just check about these words in your Google after the class whenever you get the time. You will understand. So myelin sheath is kind of a covering that covers the axon part of the neuron. Okay, so the formation of this myelin sheath, thyroid hormones are required. Okay, increased response of brain to catecholamines and increased activation of RAS. The RAS, everything is the medical part of it. Just you have to understand this, the way how your brain responds to, and the brain has receptors that can be sensitive towards dopamine, epinephrine, and norepinephrine. Okay, catecholamines, as I mentioned earlier, dopamine, epinephrine, norepinephrine. Your brain also should have sensors and receptors that can be sensitive towards the secretion of these hormones. Only then you will feel happy, you will feel excited, or you will feel anxious. Okay, and anxiety is also, a healthy amount of anxiety is also important for a human survival. Okay, you will understand stress, you will understand a stressful situation, and you will be able to respond to it because your brain is able to respond to catecholamines. Okay, so that's about the functions. Is it clear to all? Is it clear to all about the functions? This is not from the textbook. As I'm repeating again. Thyroid, this entire class is not from the textbook. So what causes thyroid problems? Problems in thyroid can be caused by iodine deficiency. That is one of the most common cause, specifically in underdeveloped countries. Okay, specifically in developed countries, iodine deficiency is one of the most common causes of thyroid issues. Then autoimmune diseases like Graves' disease, Hashimoto's disease, in which your own immune system is attacking the healthy thyroid cells. Okay, inflammation, thyroiditis, which may or may not cause pain. Some cases of thyroiditis could be painful. So other cases may not be painful. It may just be swollen thyroid gland, inflamed thyroid gland, but it may not be painful. So that is inflammation. Again, inflammatory agents, if you have a very stressful life, okay, and you have a very stressful lifestyle, you are not having enough amount of antioxidants. Okay, free radicals can go and attack any of the healthy living tissues. If it comes to, it becomes the thyroid tissues, you will get the thyroiditis. Okay, there are other causes also, specific causes that leads to thyroiditis. Any situations of hyperthyroidism, hypothyroidism, usually hyperthyroidism is associated with some or the other form of thyroiditis as well. Okay, nodules or non-cancerous lump, that is tumors, presence of tumors in the thyroid gland, thyroid cancers, certain treatments like radiation therapy, thyroid surgery, some medications can also trigger thyroid problems in certain individuals. In case of pregnancy, these medications could be subjective as well. Not every medication will have a specific context of functioning mechanism of action. Some medication may subjectively cause certain side effects on thyroid. Okay, some anti-malarial drugs, anti-diabetic drugs, okay, they are also associated with thyroid issues. But usually when these drugs are prescribed to you, when the specific drugs are prescribed to you, it will be mentioned to you as well. Doctors will usually ask you, do you have any thyroid issues? Okay, before prescribing you certain medication. It means that this medication may have the capability of maladjusting your thyroid function. Occasionally during pregnancy, pregnancy can also cause certain thyroid problems to start, and it can get worse by the end of the pregnancy, or even after pregnancy, situation can get worse. Okay, because a lot of physiological changes takes place in pregnancy. Okay, earlier during the non-pregnant stage, the woman was not suffering from any thyroid disorder, but because of pregnancy, there is an onset of thyroid disorder. Cause may be completely idiopathic. Okay, like gestational diabetes, PIH, pregnancy-induced hypertension. Okay, most of the cases, the cause of why this happened is idiopathic. We do not know exactly. That could also be the reason why thyroid problems started just because of pregnancy. Okay, some of the IVF treatment, some certain hormones, if the woman was finding it difficult to conceive, she was on a lot of hormonal therapy before conceiving. Okay, that could also lead to a pregnancy which has some turbulent thyroid issues. Okay, if it is left untreated, it can cause problems to the mother and the child as well. Okay, usually in pregnancy, yeah, it is commonly associated because again, obesity, in case of obesity, your body will be in a state of inflammation. Okay, in the same way how inflammation affects other parts of your body, the same inflammation related to obesity will affect the healthy thyroid cells as well. Okay, so that's the reason why hypothyroidism is usually associated with obesity. Miscarriage, premature birth, preterm babies, low birth weight babies, problems in the baby's brain development, because if the mother is suffering from hypothyroidism, enough amount of thyroid hormones is not present in the mother's bloodstream, which is required for the infants for the fetal embryonic uh, brain health and nervous system development. Okay, so that is the reason why the baby's brain development will be bit lagging. Okay, so these are the complications associated with thyroid problems during pregnancy. And if a woman is pregnant, or if she's planning to become pregnant, okay, she has to talk to the doctor about this, about the risk of having a thyroid disorder. Okay, usually you have to identify how many females in your family. Okay, how to prevent this? You have to first identify how many females in your family suffer from thyroid disorder during pregnancy, after pregnancy, before pregnancy, doesn't matter. You should have an idea how common it is in your family, in your genetic history, that women are suffering from thyroid disorders. Okay, because thyroid disorders is usually more common in women as compared to men. Okay, specifically in first generation female relatives like mother, daughter, sister, grandmother. Okay, aunts. So first generation female relatives, you have to identify who all have thyroid disorder. According to that, you will have to state these also to your gynecologist or obstetrician, whomever you are visiting. Okay, and then it will start from that. The thyroid panels test will be given to you, and your present status quo of your thyroid activity will be checked, and according to that, if treatment is required, you will be prescribed certain medication. Throughout the pregnancy also, you can take medication for thyroid issues. When to check with doctor? You have to identify the symptoms of an overactive thyroid. What are the symptoms of underactive thyroid? We will discuss that now. If you feel a lump or swelling in your neck, specifically when you have to touch your neck from both the sides, try to swallow your spit and see what kind of movement you do. You feel any obstruction? Do you feel any lump? Okay, you can check certain YouTube videos on that, on how to self-assess any thyroid lump or lumps in your neck. Okay, so based on that, if you feel such certain lump or swelling, abnormal swelling in your neck which was not there present, okay, which was not present earlier, but now it is there. So in such case also, you have to visit an endocrinologist. Concerns about the risk of thyroid problems during pregnancy. Once a woman is pregnant, usually when the obstetrician is taking a case history, okay, you have conceived and you visit a obstetrician. Okay, when she is taking your case history, usually they will ask all these questions. Okay, so you have to completely leave it on the obstetrician's judgment to understand your present situation, what further test she has to prescribe to the patient, to the client. Okay, from there onwards, the treatment will start. If only it is required, the treatment will start. Along with the pregnancy, thyroid medications will also be given to the mother, so that the growing fetus brain development is not affected, or other complications of pregnancy should not be overseen. So these are the symptoms of, and on the left side, you can see the symptom of an underactive thyroid secretion, and on the right is the overactive thyroid secretion. So hypothyroidism, cold intolerance, you cannot, uh, even if you're sitting under a fan, the air from the fan, air currents of the fan make you feel chilly. Okay, weight gain. Weight gain is not too much. Okay, you cannot attribute your lifestyle choices on thyroid issues. We will see that later. It's one of the myth busters. Constipation, incomplete emptying of bowel is also seen. Decreased sweating, you don't sweat much. Depression, irritability, irregular periods and heavy periods. Slow heart rate, because the pulse rate is down, the cardiac output will also be reduced. Okay. Even the blood pressure, systolic blood pressure will also be on the lower side. Brittle nails, easily breakable nails, puffy face, joint pain, muscle pain, fatigue, insomnia, hair loss can be associated with both of the conditions. Okay, both of the extremes will show certain degree of hair loss, insomnia, fatigue, insomnia, sleeplessness, fatigue, too much of tiredness, no, not having any interest to do any activity. Okay, coming to the hyperthyroidism, overactive, overproduced thyroid hormones, weight loss, and in specific cases weight gain is also seen because of lifestyle choices. Okay, short and very light periods, puffy face and bulging eyes, increased sweating, and they do not have they cannot tolerate heat at all. Okay, nail thickening and flaking, heat intolerance, and racing heart, because the cardiac output is much more. It is complete opposite of hypothyroidism. So blood pressure will also be quite high in hyperthyroidism. Muscle weakness, diarrhea, okay, nervousness and anxiety. Here you can see it is depression and irritability. On the other side, you can see it is nervousness and anxiety. Okay, which will again induce more sweating. Nervousness and anxiety, which will again induce more sweating as a reaction. So is it clear about the symptoms, some basic symptoms of hyperthyroidism and hypothyroidism? What are the complications of thyroid problems? So an enlarged thyroid gland or goiter can cause certain problems with swallowing and breathing. Okay, because it is trachea, which is just behind the thyroid gland. So if the thyroid gland keeps enlarging, it is going to compress your trachea, your windpipe. So definitely difficulty in breathing will be there, and behind that you have your esophagus as well, your food pipe. Okay, so difficulty in swallowing and breathing will be there with enlarged thyroid gland or goiter. Graves' disease can cause eye and skin problems. Graves' disease is an autoimmune disease in which thyroid gland is affected. Symptoms will come again. We will discuss that again. An overactive thyroid gland can lead to problems including heart problems, as I mentioned, nervousness, anxiety, racing heart, okay, heart palpitations. That is, you feel the heart thumping on your chest for no reason at all. Okay, usually it happens when you are scared, when you're too excited. Okay, when you are in a fight or flight mode. In that situation, definitely every human being who has a uh, who has a positive response towards the social environment, definitely they will feel that heart chest palpitation. Okay, heart is thumping on the chest. But here, in case of hyperthyroidism, no, for no reason at all, even when you're sitting stress free, heart palpitations will be there. Okay, so heart problems such as rapid heart rate, problems with your heart rhythm, cardiac arrhythmias, arterial fibrillation, or heart failure in extreme cases can take place. Low loss of bone density because of osteoporosis can take place in an overactive thyroid gland, that is hyperthyroidism. If the thyroid is underactive, in case of hypothyroidism, complications like high cholesterol level, high blood pressure, heart problems, usually associated with obesity. Okay, obesity and hypothyroidism are kind of interrelated because of inflammation. When too many healthy cells, healthy cells and tissues of the thyroid gland stays inflamed for a prolonged period of time, okay, it will become inactive. The more inactive cells you have in your thyroid gland, the less will be the amount of thyroid hormone secreted. That is one of the association. Okay. Complications that require immediate medical attention. In this case, immediately the patient has to go in into the emergency room. Thyroid storm. It is a severe excess of thyroid hormone, too much of thyroid hormone. Symptoms can include fever, rapid heart rate, vomiting, delirium. Delirium is you do not have, you're disassociated with where you are, who you are, okay? You do not have any idea what your surrounding is, what you should say, what you should speak, how you should act, okay? That is delirium. So something like this, the patient's eyes will bulge out, okay? They stay in a state of excitability. Their eyes are bulged out, and it a very stoic expression, not much expression. They have a very stoic expression. So this is how a thyroid storm may look like. Okay, and also in case of Hashimoto's diseases as well. Okay, the same kind of thyroid storm can take place. Then myxoedema coma. Myxoedema coma is a very rare condition, but it is a very life-threatening condition. It is caused by untreated severe hypothyroidism. You are hypothyroidic by nature, but you're not taking any medications to correct it. Severe case of hypothyroidism, which is left untreated. It causes drowsiness that can lead to unconsciousness. That is the reason why we use the comma word here. Myxoedema, comma. Okay. Slow breathing, low body temperature, because the cardiac output falls down in a very rapid pace. It will fall down. That definitely your body temperature will fall. First of all, the peripheral body, the extremities will become very cold and flaccid. Okay, and slow breathing, because the contraction level is not there, the respiration count is not there. So this is a person who's a presentation. It's a clinical presentation of a myxoedema coma. Okay, immediately the patient has to be admitted to the emergency department, and from there on clinical management is done. We can only share with you the symptoms and how the case presents. Clinical management is completely the hospital's department. That management part we will not be discussing in this class. So thyroid diseases include hypothyroidism, hyperthyroidism, thyroid cancer, nodules. Okay, these are the most common cases which any primary practitioners and any endocrinology department sees on a daily basis. Okay, the evidence is strongest for adequate but not excessive iodine intake. Okay, to benefit the thyroid health in general. Usually, it's very common in underdeveloping countries. In developing countries, thyroid disorders are usually associated with obesity related and not always because of iodine deficiency, as well as selenium supplementation for patients in Graves' disease is also one of the way how thyroid disorders or thyroid symptoms can be brought down. Selenium supplementation also works. That is clinically evident. Aside from this, iodine supplementation or iodine-based medication, selenium supplementation, apart from this, there is very little evidence or scientific data that shows that if you do some dietary changes, you can significantly benefit from hypothyroidism, reducing hypothyroidism or hypothyroidism. Okay, dietary changes, it's just a lifestyle choice, but making dietary changes is not going to cure hypothyroidism or hyperthyroidism. Okay. So coming to hypothyroidism, symptoms, repeating the symptoms, thinning and thinning of hair loss, puffy face, even the loss of eyebrow hair, enlarged thyroid gland, dry and coarse skin, slow heartbeat, constipation, poor appetite, infertility, irregular periods, heavy periods, cold sensitivity and sweating of limbs as well. Cold sensitivity, they will always feel chilly. Carpal tunnel syndrome, very rare. Carpal tunnel syndrome being associated with hypothyroidism. It's only in the extreme cases. Weight gain is also seen in majority of the hypothyroidism cases. Poor memory, intolerance to cold, cannot stand cold at all. Feeling tired, lethargy. It affects 7% of the general population worldwide. Iodine deficiency is one of the leading cause of hypothyroidism globally, specifically because of the rate of iodine deficiency seen in underdeveloping countries. Levothyroxine is the generic name of the medication given as a hormonal replacement for thyroid hormone, and it is one of the most commonly prescribed medication. Many foods and substances also can interfere with how this levothyroxine can be absorbed. Okay, so that is the reason why doctors who prescribe it, they specifically tell you not to take levothyroxine along with your meals. It has to be taken separately. Okay, after at least the stomach has been emptied, after that levothyroxine has to be taken. At least keep a 2 to 3 hour gap between your meals and taking the medication. The timings and everything will be given by the prescribing doctor. So that is about hypothyroidism. Hyperthyroidism, again, hair thinning and hair loss is seen in both. Bulging eyes, enlarged thyroid gland, frequent sweating, and heat sensitivity is here, not cold sensitivity. Enlarged liver, abnormal heart rate is quite high, cardiac output is quite high. Increased appetite is seen in hyperthyroidism. Vomiting and diarrhea, that is the gastrointestinal issue. Irregular menstruation and scanty periods. Periods are hardly 1 day, 2 day, and very less amount of blood loss is witnessed. Hand tremors. And hand tremors could be the reason of anxiety, excessive anxiety, and nervousness. Nervousness and anxiety is associated with hyperthyroidism. So hand tremors be associated to that as well. Irritability, nervousness, heat intolerance, sleeplessness, insomnia, vision problem. Hand tremors is when your hand is shaking. Okay, when you are scared, you must see there is a slight shake in your fingers, specifically at the end of the fingers. That is hand tremors. Tremors means that, okay, shaky hands. Hyperthyroidism is present in up to 1.3% of the general population, much less than the cases of hypothyroidism. Graves' disease is one of the leading cause of hyperthyroidism. That's an autoimmune disease, but we have other etiologies as well. Etiology means causing factors, okay? Causes. Etiology means causes. Include toxic nodular goiter, like too much of iodine toxicity. Iodine toxicity can also lead to hyperthyroidism. Thyroiditis, that inflamed thyroid gland, could also lead to hyperthyroidism. Conventional therapies for the treatment of hyperthyroidism are anti-thyroid medication that inhibits the secretion of T3 and T4. Okay, radioactive iodine treatment and thyroid surgery to take some part of the thyroid away. If it is too hyperactive, just take a part of thyroid away to bring down the hormonal secretion. Dietary iodine and selenium are micronutrients that can modify the thyroid antibody titers. Okay, these are the clinical aspect. As a nutritionist or as a dietitian, they're not supposed to prescribe any specific iodine and selenium supplement. It's only based on the patient's blood reports and to see how the prognosis is, how the patient is responding to the treatment given, medical, surgical, or radiation therapy, whatever the patient is receiving, how the prognosis is, how the patient is responding to the treatment. The consultant, the physician will change the course of medication. As a nutritionist or as a dietitian, you're not supposed to interfere with the course of medical management. Okay. Hashimoto's thyroiditis, it's an autoimmune disease. Again, thyroiditis, inflammation of the thyroid gland. It can cause goiter as well. Goiter means enlarged thyroid gland. Swelling in the neck due to enlarged thyroid gland, and other symptoms. Other symptoms include, again, sweating, fatigue, heat intolerance. All the symptoms of hyperthyroidism is seen here. Changes in the mood swings, tremoring hands, that is shaky hands. Changes in the bowel movements, diarrhea. Okay, some days it is normal defecation. Some other days it is diarrhea. So this is about Hashimoto's thyroiditis. Then thyroid tumors, thyroid nodules or tumors or adenoma. Adenoma means your body has different kind of cells, right? So whenever glandular cells means the cells that are supposed to secrete something, either mucus or hormones, okay? So the cells, the tissues, the cells that make up the tissue that is supposed to secrete something. That is, and if any tumor takes place in the glandular cells, we call it as adenoma. Okay. Carcinoma, adenoma. Am I audible to all? So adenoma is when the glandular cells, tumors affect the glandular cells, secreting glandular cells. We call it as adenoma. So it is small, non-cancerous growths. When it is tumors, it is non-cancerous. Okay, you can surgically remove the tumor away. Okay, it is not spreading. Cancerous means it spreads. Malignant, and malignancy means it spreads. Tumor means it does not spread. It just stays there. Easy to remove it. And start in the cell layer that lines the inner surface of the thyroid gland. So it starts from inside, and slowly the adenomas can spread to the outside as well. Adenoma itself may secrete thyroid hormone and it may lead to hyperthyroidism. Because adenoma, what it is also, what is a tumor? It is a rapid proliferation, rapid differentiation and proliferation of the existing cells. Okay, and in some case, if it is malignant proliferation, it will not have a well differentiated cell structure or structure, size, form, shape is not there in malignant tumors, in cancers. Okay, it will spread haphazardly, and it may or may not be functional. Okay, but usually in adenomas or in tumor cells, whatever cell differentiation and proliferation we see, okay, that has a specific structure, a healthy cell structure, healthy cell function, because of which these tumors can also secrete thyroid hormones. These tumors will also respond to the TSH, thyroid stimulating hormone, and it can secrete thyroid hormone. So this is the reason why you already have a thyroid gland with healthy amount of thyroid cells secreting thyroid hormone. On top of that, if you get tumors, those will also start secreting thyroid hormone. That leads to hyperthyroidism. Okay. So thyroid adenoma treatment can include surgery. It can remove the overactive nodule. Okay, that could be another management for this. And 90 to 95% of these thyroid tumors, thyroid nodules, will stay non-cancerous. They will not spread. But there are certain chances that tumors can turn malignant. These tumors can turn cancerous. It can spread. Okay, 3 to 5% are cancerous. Thyroid cancer, it occurs more often in people who have undergone radiation to the head, neck, or chest. Okay, if, like, for example, for smokers, if they have undergone oral removal of the jaw, or some other form of cancers they had, or they had brain tumor, okay, or an upper lung tumors, cancer. Okay, when they undergo radiation, usually it can negatively affect the thyroid gland as well. It could lead to thyroid cancer as well. Okay. However, it may also occur to those who does not have any risk factors to cancer. Okay, people who do not have any family history of that thyroid cancer can also have thyroid cancer. Okay, and most of the thyroid cancer can be treated successfully. If it is caught earlier, it can be treated successfully. Usually, you will have a painless lump in the neck that increases in size day by day. Enlarged thyroid gland, goiter will be seen. Difficulty in swallowing, difficulty in breathing is seen. Hoarseness of voice, change in voice, and hoarseness of voice, because larynx will be getting compressed as well. So a shift in the voice will be observed. Thyroid disorders in women. Women's thyroid disease can affect their hormonal balance. It can cause problems during puberty. Whenever the thyroid disorder affects the woman, immediately issues in their puberty, either delayed puberty or early puberty, menstruation, heavy periods or very scanty periods, irregular periods, fertility, difficulty to conceive, or even if you have conceived, to carry on to the end of the pregnancy is difficult. Miscarriages, spontaneous miscarriages, preterm babies, stillbirth. Okay, these all are associated with thyroid issues. Pregnancy and postpartum period, postpartum depression, postpartum thyroiditis. We will discuss that also. So these are the common associations of the reproductive disorders of women and thyroid disorders. Thyroid hormone replacement therapy. So thyroid hormone comes in a pill form. It is levothyroxine, usually that's a generic name. And it is often used to treat an underactive thyroid gland and which is secreting little or no thyroid hormones. And usually it is a synthetic thyroxine. Levothyroxine is the generic name for it. Hypothyroidism and pregnancy. Thyroid hormones has to pass from the mother to the fetus for the child's adequate growth and development of the brain. Okay, specifically the brain, it is important that the thyroid hormones has to cross from the mother's body to the placenta and reach the fetus. In case of hypothyroidism during pregnancy, you can completely and safely treat hypothyroidism during pregnancy with this medication. With the thyroid hormone replacement therapy, you can treat hypothyroidism during pregnancy. It will not affect negatively the child or the pregnant mother. So if it is not treated, if hypothyroidism is not treated in pregnancy, it could lead to some complications like gestational hypertension, that is blood pressure, high blood pressure, which happens only during pregnancy. Before pregnancy, the mother was not having any high BP, but only during pregnancy she got it. Gestational diabetes. Before pregnancy, no diabetes. During pregnancy, diabetes came. After pregnancy, diabetes vanished. Okay. Abruptio placenta. Placenta usually associated with placenta previa. Placenta has to sit on the upper part of your uterus and the child has to be below it. But in certain cases, the placenta will sit near to the cervix, okay, near to the vaginal opening. So during pregnancy, it may not have much complications. It can have later, but specifically during the childbirth, when the uterus goes into the state of contraction, okay, it can lead to hemorrhage, it can lead to bleeding, excessive bleeding, and it could cause maternal mortality, infant mortality, both. Okay, so that is abruptio placenta. Postpartum hemorrhage, uncontrolled bleeding after pregnancy. Then coming to the fetal complications, what happens to the child? Abortions, spontaneous abortions, that is miscarriage, premature birth, stillbirth, a baby who is born dead, low birth weight babies. Okay, these are associated with the complications of hypothyroidism in pregnancy. Postpartum thyroiditis, this is inflammation of the thyroid gland after delivery, after labor. So soon after giving birth, it can cause hyper or hypothyroidism. Both could lead to inflammation. Okay, this inflammation could cause either hyperthyroidism or hypothyroidism. Okay, it can aggravate the function of thyroid gland, leading to hyperthyroidism, or it can destroy. This inflammation can destroy certain healthy cells in the thyroid gland and lead to hypothyroidism. Okay, it is treatable with medication. In about 80% of the cases, it resolves within 1 year or within 1.5 years. You can resolve the thyroid issues in the lactating mother. But it has to be resolved. Otherwise, there will be suppression in lactation. Breast milk will not be produced adequately for the child's nourishment. So these are the symptoms of postpartum thyroiditis. Decreased milk volume in breastfeeding women, painless goiter, hair loss. Hair loss is usually associated with postpartum any which ways. Fatigue, depression, anxiety, and moodiness. Okay. Coming to the dietary management, dietary influences on thyroid health. First is the presence of iodine in your food. It has to be adequate. Goitrogens, that goitrogens has to be avoided. It causes goiter. It causes hypothyroidism. Okay. Cruciferous vegetables, it is still controversial. We will come to the myths later. Soy-based products, okay, we will discuss about that also, and other trace minerals. All these we will discuss in detail. So iodine, functions of iodine, first you have to understand for your thyroid hormones, for the healthy secretion of thyroid hormone. Adequate amount of iodine in the circulating blood is important. Adequate, not more, not less. It supports the thyroid function, supports the healthy growth and development. If thyroid functions is supported, healthy growth and development will be achieved. Overall metabolism will also be achieved because of thyroid. healthy thyroid. Maintain your energy level. If metabolism is maintained, if healthy amount of energy is produced, you will have healthy amount of energy levels to do your day-to-day work. You will not feel lethargic. Regulate your body temperature. Okay, you must have seen in hyper and hypothyroidism, body temperature plays an important role. One is sensitive to heat, one is sensitive to cold. So if the body temperature is regulated, you can survive in, you can tolerate both changes in the atmosphere. So iodine, the production of thyroid hormone within thyroid follicular cells, that is with the cells of your thyroid gland, is the thyroid follicular cell, requires adequate levels of circulating iodine taken through diet. Okay, only through diet you can get the iodine. Common dietary sources of iodine is your iodized salt, that is the first source, table salt. All types of seafood, including seaweed for vegetarians and fish for non-vegetarians. Some breads and grains also have iodine, specifically the ones that are grown near the coastal area. Okay, coastal areas, peninsular region of India, whatever grains or whatever plants and vegetables are grown there, it has higher concentration of iodine as compared to the northern parts of the country. Although eating a regular diet should meet the iodine needs, some individuals who go on a restricted diet, like vegetarians, vegans, okay, they are at a higher risk of inadequate iodine intake, because vegetables are not a rich source of iodine. Vegetables definitely have iodine, but you can't call them a good or the best source of iodine. Okay. So for them, table salt, seaweed, they have to resort to certain supplementations, or multivitamins must be taken only under prescription. Coming to goitrogens, the term goitrogen refers to any substance that can produce goiter. Goiter means enlarged thyroid gland. Okay. So this is usually accomplished through effects that decrease the thyroidal iodine, the iodine that is supposed to increase the thyroid activity. Goitrogen will inhibit that iodine. Okay. So some common examples of dietary vegetables that or dietary sources that have goitrogens are all your cruciferous vegetables and soy products. Okay, like examples are shown on screen: cabbage, turnips, kale, cauliflower, beans, millets, broccoli, Brussels sprouts, radish, sweet potato, tapioca. Cassava is the another name for tapioca. Okay, so those who have a low functioning thyroid, they do not have to completely avoid this. They just have to restrict the use of it. Okay. No need to completely avoid this from your diet. You can definitely have it. Not all millets. Usually it is jowar. Okay. Sorghum or jowar. So you do not have to completely take it away from the diet. You can definitely, have people who have hypothyroidism, they can have cruciferous vegetables, but the amount should be restricted, not on a daily basis, weekly once, okay, monthly thrice, like that. You can restrict the amount of intake of the cruciferous vegetable. No need to completely stay away from it. So cruciferous vegetables are those in the Brassica genus, that is the species, like broccoli, cabbage, Brussels sprouts, kale, turnips, cauliflower, collard greens, bok choice. Okay, most of it are like not found in the rural parts of India or other small towns. In only major cities, in hypermarket and all, you will find this Brussels sprouts, broccoli, collard greens, bok choice. Okay, bok choice are used in the Chinese cuisine as well as Korean cuisines. Other garden cress also is a cruciferous, comes under cruciferous vegetable. Radish, turnips, mustard leaves. Okay, these are used in Indian cuisines as well. So they are rich in glucosinolates, which is associated with carcinogenic property. So this is a really good antioxidant. Okay, glucosinolates is a really good antioxidant, but one downside of it is that it will inhibit the thyroid hormone production. Okay. Mustard leaves they have shown. They have not mentioned mustard seeds. Mustard leaves they have shown. Okay. Because the culprit here, which inhibits thyroid hormone production, is glucosinolates, which may not be present in mustard seeds, but in mustard leaves, because since it is an antioxidant, okay, it will be present more in mustard leaves, not in the mustard seeds. So although eating cruciferous vegetables certainly has various other health benefits, regular consumption of large quantities, okay, if somebody is having excessive amount of these cruciferous vegetables on a daily basis, only in that condition it could lead to hypothyroidism, or it can aggravate the present, even if you have mild hypothyroidism. Mild hypothyroidism, on a daily basis you have excessive amount of cruciferous vegetable, only then it can aggravate your hypothyroidism. Otherwise, it does not have much effect. Okay. Soy products. So dietary soy products, including soy milk, tofu, soy sauce, tempeh, they all contain this flavonols. Misos also, they also contain this flavonols. That is also a culprit here, which inhibits the iodine absorption, which can inhibit the action of thyroid perioxidase. It is an important enzyme which is required for thyroid hormone synthesis. Okay, this enzyme is required for thyroid hormone synthesis. In the presence of isoflavonols, the enzyme decreases and hormone will not be produced. So it has been proposed that dietary soy may increase the risk of hypothyroidism. If you already have a genetic predisposition, female members of your family, along with that male members of your family, have some or the other sort of hypothyroidism issue, even if it is mild hypothyroidism that members of your family are suffering from, it's better you avoid too much of soy on the regular consumption. On a regular basis, do not consume soy milk, tofu, soy sauce, everything in a single day. On a daily basis, you should not consume. Once in a while, you can definitely take soy-based products. That it's not an issue. Okay. So the risk of hypothyroidism in euthyroid individual. Euthyroid individual means people who have a healthy functioning thyroid gland. They do not have any history of hypothyroidism, or hyperthyroidism. That is euthyroid individual. Okay, who have a healthy functioning thyroid gland. You do not have to, again, I'm repeating it. It's a myth. We will come to that later. Euthyroid individuals living in iodine replete areas, consumption of soy probably has no adverse effect on serum thyroid function. Okay, which means if you live in certain zones, for example, the Himalayan range, okay, central India, the Himalayan range, okay, the east and the west side of the country, these zones are naturally known as the iodine replete areas. Okay, the soil the soil mineral iodine present is quite low in these regions. So if you are a person who is born and brought up there, who is still living there, okay, if you consume soy-based products on a daily basis, it will not have any adverse effect on your thyroid functioning. But with an exception, you should not be having hypothyroidism in the first place to begin with. Okay. But other people who live in a well thyroid well iodine rich areas, okay, iodine soil, iodine mineral rich soil areas, in that areas, even if you still consume having too much of soil, too much of soy, it can inhibit the thyroid peroxidase enzyme production. Yeah, that is one of the reasons why vegetarians and vegans are at higher risk of thyroid disorders as compared to non-vegetarians. So why cannot we just avoid soy? Okay, because we have various evidences that shows that soy can reduce the risk of autoimmune disorders. It can also reduce the risk of breast cancer, mortality from breast cancer, prostate cancer, hip fracture, because it's a good source of calcium. Soy milk, soy-based products are a good source of calcium as well. Cardiovascular diseases. So soy has so many other health benefits. Okay, that is the reason why soy cannot be taken out of market just because it's association. Okay, again, I'm repeating the statement. Association is not causation. Okay, soy definitely is associated with too much of excessive consumption of soy is associated with hypothyroidism, but soy is not the cause of hypothyroidism. Okay, association is not causation. Selenium. Selenium is a micronutrient which is important for thyroid hormone metabolism. Richest source of selenium obviously comes from the seafood and organ meats. Vegetarian sources are also there, like brown rice, sunflower seeds, oats, Brazil nuts. Okay, these are also good sources of vegetarian sources of selenium. Not the best sources, but good sources. So typical sources of selenium in diet is through your whole grain breads, grains, meats, for all poultry, fish, eggs. Some studies have also shown the benefit selenium supplementation in individuals who have autoimmune thyroid disease like Graves' disease, Hashimoto's disease, Hashimoto's thyroiditis. In such disease, selenium supplementation under prescription has shown certain benefits. So other trace elements which are associated with thyroid health, zinc, copper, magnesium, that can help in the thyroid hormone synthesis and also metabolism. And there is a meta-analysis studies of 8 meta-analysis means a big data, a huge data was studied. Okay, that is meta-analysis of 8 studies suggested that there is a relationship between levels of selenium, copper, and magnesium with thyroid cancer. Low levels of selenium, copper, and magnesium, and its association with thyroid cancer. So all the patients who had thyroid cancer, they have seen very low levels of selenium, copper, and magnesium. So this was the only meta-analysis done. Given the available scientific evidences, implementation of these trace minerals solely for the purpose of promoting thyroid function is not supported. Okay, so if you're taking multivitamins which has all these trace minerals, it should support your other health aspects also. Just for the sake of thyroid health, you're taking these trace elements. It's not a supportive action. Okay. Other dietary considerations for thyroid health. Coffee decreases the absorption of oral levothyroxine. So do not consume your thyroid hormone replacement drug, that is levothyroxine. If you are on levothyroxine, do not consume it along with coffee or in that same 1 hour window. Coffee, tea, and alcohol, okay, they are known to decrease the absorption of this supplement, this medication. Gluten-free diets, sugar-free diets, probiotic, okay, are advocated for promoting thyroid health. They are advocated for promoting thyroid health, but there is no association of gluten-free diet, sugar-free diet with thyroid health. We will see that later. It's because it is one of the myths. So coming to the myths about diet and your thyroid. First myth, you can't eat cruciferous vegetable if you have thyroid disorder. It is wrong. You can have, okay, with a limited quantity with a proper portion control, okay, because hypothyroidism and its association with cruciferous vegetable is seen only in some rare cases where they are having cruciferous vegetable on a regular basis, daily basis, in an excessive amount. There was one case of a Chinese woman who was having bok choy day, night, okay, at least around 3 to 4 kgs of bok choy throughout a day she used to consume. That was her only diet. She did that to prevent the cardiovascular situation, or she was suffering from some cancer or something, to bring the symptoms of that disease condition down. She resorted to having only bok choy on a daily basis, around 2 to 3 kgs, and she developed the severe form of myxedema coma, okay, which we have seen, myxedema coma, which is an emergency situation. So that was only one case that was registered, which showed the association of that bok choy, which is a cruciferous vegetable, and hypothyroidism, extreme case of hypothyroidism. But you should see also, analyze that what kind of extreme steps she took to try to find a cure through natural food, natural sources for some other disease condition, and what it landed her into. Okay, so that was the only case. So having cruciferous vegetable, if you have hypothyroidism, is okay under limited portioning, in a limited portioning, not on a daily basis. Okay, if you can keep that in mind, you can follow. You can still indulge in cruciferous vegetable even if you suffer from hypothyroidism. But along with that, your medication should be going on. Your treatment should be going on along with that. Myth number 2, you should take iodine supplements if you have underactive thyroid. Specifically, if you live in India, if you're living in any developed countries, you do not require any supplementation, any iodine supplementation for your thyroid health or hypothyroidism. Okay, in majority of the Indian food, in India, iodized salt is a norm. Okay, by law, the salt sold in India has to be iodized. Iodine fortified iodine fortification is not just limited to salt. Okay, iodine fortification is seen in oils as well, in other food as well. You find any packaged food or find any tetra packaged milk, plant-based milk, you will find some form of iodine fortification present in that. Okay, so majority of the food items you bring from outside, it could be your oil, it could be any food items you get from outside, from market, you will see some form of iodine fortification in that. Okay, so it is very difficult. You do not have to take iodine supplement until and unless it is clinically required. And if it is a specific rare case, you are suffering from severe kind of hypothyroidism. In that case, your physician or your endocrinologist may prescribe you an iodine supplement. Only then you will require it. Otherwise, nobody requires iodine supplements. Okay. Myth number 3, a gluten-free diet can help with Hashimoto's thyroiditis or cure it. It's wrong. Only if a person who has celiac disease, okay, a person who is suffering from celiac disease will benefit from gluten-free diet. Nobody else benefits from gluten-free diet. Okay, and there is no association of gluten-free diet and its cure for Hashimoto's disease or any thyroid disease for that matter. Okay, gluten-free diet is prescribed only for patients who have celiac disease. Okay, it is for others, the presence of gluten or absence of gluten is not going to be a trigger. Myth number 4, weight gain is from hypothyroidism. Okay, the only weight gain you may see because of hypothyroidism is hardly 3 kgs, less or more. Okay, not more than that. If you are gaining more than 3 kgs, that is completely your lifestyle choices. That is completely the mismatch of the equation of your calorie balance. Okay, your energy balance. If it is a positive energy balance, then it means that you are gaining weight. You are having more energy than what you spent. This positive energy balance. So that is the reason why you're gaining weight. Hypothyroidism is not the reason for weight gain. If it is more than 3 kgs or 4 kgs, it is not because of hypothyroidism. It is completely based on your lifestyle, your choice of diet. Okay. Myth number 5, people with thyroid disorders need to be on special diets. It's not required. The only thing you have to do is to be on a balanced diet, to have a healthy balanced diet. Even that applies for thyroid patients as well, to be on a healthy balanced diet. Okay, which can also include cruciferous vegetables. It can also include soy products to a limitation. Okay. So concluding to today's chapter, apart from the definitive role of iodine and selenium deficiency in the causation of hypothyroidism, there is no other role of any other dietary factors that can lead to hypothyroidism. Okay, this is based on the scientific studies done. Whatever medical scientific evidences we have, the only thing that could lead to hypothyroidism is the deficiency of iodine and selenium. Okay, no other dietary factors has its association with the cause of hypothyroidism. Much remains unknown about thyroid disease, and there are areas of uncertainty in modern medicines for which continuous research is required. We require more studies to come to any permanent conclusions. Till then, whatever data is available right now, you have to just follow that. So that's all for today. If you have any queries, you can mention in the chat box.